welcome back to Quake Clinic. How are you today? Good, okay. Well, if you forgot, my name is Nurse Elo, and I'm here to do some ear tests on you today. Yeah, okay. Just making sure. So what's been going on for you? Okay. Mm-hmm. Any ringing? Yes. Is it persistent or does it come and go? Okay. About how often? Per day? Okay. Alright. That is no fun. Anything else that you've noticed? Okay. Okay. So put that under this. Let me think. Is it like a shooting or throbbing? Okay, okay. Okay. Well, today, basically what I'm going to be doing is first doing a little examination. I'm kind of going to just quickly test all your senses a little bit. Maybe not all of them, but close to it. And do sort of like a general wellness check. A lot of the times when we have sensory issues, they can be linked to one another. They can be a symptom of something else. It's really difficult to say clearly what the issue is when it comes to something like a problem with the ears. You can have sinus things that are affecting your ears. You can have lymph things that are affecting your ears. You can have headaches that are affecting your ears. You can have tooth pain. So there's a lot of different factors that we need to consider, and the treatment courses vary pretty differently as well, which is kind of unfortunate because there's no one drug or sort of therapy that we can say, okay, do this and no matter what you'll be fine. So it's a very delicate sort of balance, which I guess makes sense because the ear is a very delicate structure. But of course it's uncomfortable and kind of scary when something's wrong with our hearing, especially. So yeah, I don't blame you for booking an appointment. And this is best anyway, just to get it checked out and make sure that it's nothing serious. Okay? Alright. Do you have any questions for me before we start? That's right. So after I give you kind of the once over, we're going to move into a sound test, and it's not going to be like tonal, so you're not going to have to match pitches or tell me which one is higher or lower, that kind of thing. I'm going to be sort of issuing a series of taps that are going to be moving progressively away from your ear. And these are going to be from different objects, the tapping. So the tone is going to differ. Sometimes it might be a more hollow sound. Sometimes it might be a almost a higher pitched sound, if that makes sense. Yeah. And we're just going to see sort of how that varies. I'll probably ask you to tell me any comparison that you feel between certain ones. If you say, oh, these two sound very similar, I can't hear this one at all, this one sounds like the first one, that kind of thing. Okay? Yeah, so nothing difficult. Okay, great. So we can get started. Okay. So I'm gonna put on some gloves first for the preliminary examination. Just for hygienic purposes. But I will have to take them off before the tapping situation starts. Okay, so I'm going to grab my otoscope to take a look at your eyes, your nose, your ears, your mouth, okay? As you know, we kind of keep the rooms dark here when we're dealing with sensory issues because a lot of the times they can kind of commingle and cause headaches and all kinds of nasty stuff. So I hope the ambiance is okay for you. Okay. Alright, can I get you to look over here, please? And over here. Okay. Can I get you to just follow my finger up? Very good. And down. Okay, great. Can I have you tilt your head back just a little? Okay. Okay. Alright, your nose looks fine. Can I have you open your mouth now and just say, ah? Okay, good. I'm gonna check in your ears now. Okay. Gonna take a little more time on this since this is what we are here for. I do see a little bit of wax build up on this side. Kind of reddish, pinkish, a little more so than I would hope for. Is it tender? Okay. Okay. Look at the other side. Alright. And this is the side you said hurts a little more, your right side. Yeah. I do see okay. Okay, there's a little bit of a plasma before your eardrum on that side, which can certainly cause some troubles and pain as well. But I'm not entirely certain that that's the full issue. Sometimes people do have just a really, really thin layer of plasma, and when you kind of open your jaw or yawn, you can hear a little crackling in your ear. Yeah, it's similar. It can happen a lot when you're actually sick, but I don't see any other signs of like an infection, so that may just be normal for you. And yeah, it's pretty harmless for most people. Maybe a little annoying. All right, just make some notes about what I saw. And about your other senses, have you had any issues with, has your palate changed for taste? Is there anything that you used to eat that you really liked that you can't really tolerate anymore, or something that you used to not like that you suddenly started liking? Okay. Sense of smell, has it diminished at all? Gotten stronger? Nothing you've noticed? Okay. Alright, it's kind of hard most of the time unless there's like a really, really distinct difference. A lot of us don't notice because some of these things happen more gradually, and you'd need to be keeping like a daily log of body symptoms to really be able to tell when things started and how they progressed. So no worries there. Do you mind if I just feel around your sinuses a little bit? Okay. I'm gonna press on your forehead. Is that okay? Okay, I'm gonna move towards your temple and press. Does that feel okay? Alright, and now right next to your nose here. How's that? Okay, I'm gonna press under your throat and just feel for a second. Does your throat ever feel swollen? Dry? Painful? Itchy? Okay. I'm gonna press a little bit. It might be a tad uncomfortable, but can you swallow for me? Good. Okay, can you do it again? Okay. I would say that your right one is a little more, well, it's protruding a little more than the left. I don't want to say swollen because I don't know that that's really the case. Okay, I'm going to press on your chin. Everything feels fine. Okay. I'm going to use my thumbs now, and I'm going to press fairly hard, right sort of in this area near your eye and nose, okay? And I want you to kind of resist me, so don't let your head swing back. Just kind of try to almost push into it, and let me know if it becomes too uncomfortable, okay? Okay, felt alright? Okay, good. Alright, that looks fine. Can I get you to look sort of diagonally up? So I want to be able to see this muscle along your throat pretty well, and also your ear. Either side's fine. Okay, so just keep looking up this way. I'm just gonna feel a little bit down your throat and up to your ear. Okay. Alright, can you do the same thing? So look kind of up this way. Okay, I'm just gonna feel again on this side. It's a little tender. Okay. Just gonna move up to your ear. Okay. Alright. Can I now get you to look just to the side? You don't have to look up, just to your side. Okay. Okay, and the other way. Okay, and then straight at me, and I'm gonna kind of crawl my fingers up your throat, okay? On the outside. Okay, you swallow again for me. Good, good, good. Okay. Okay, couple notes. Was there anything that was the most uncomfortable out of those? And how would you sort of rate that on a pain scale? Just like a 2, 3. Okay. So more tender than actually painful, so to speak. Okay. Second. Going to do a little bit more with your eyes before we move on. Good. Alright, so I'm going to have my flashlight, and first I just want you to sort of follow it. So I'm going to trace an H shape, and I'd just like for you to use your eyes only. Don't, move your head along. Just keep your head straight, still, and follow the light. So we're going to start right up here. Good, you're doing great. Is that out of your field of view? Okay. And how about now? Okay. You can just blink a little bit, relax. Are you feeling any pain or pressure, tenderness, any soreness in your eyes? No. Okay. The next thing I'm going to have you do is I'm going to get you to focus on my finger. Okay, and then I'm going to pull the light into the frame. I'm going to look. Okay, and I'm gonna have you look at the light. Okay, so all you have to do is look at my finger, and then when I say look at the light, but don't look at it until I say. Easy enough, right? Okay, so I'm gonna step back a little bit. Okay, can you see this here? Okay, so just look at my finger for me. Okay, and look at the light. Good, okay. Can you see this here? Good. Okay, so just stare at my fingertip. And look at the light. Okay, good. Alright, next I'm gonna come in and do a bit of a close-up. Okay. Alright, so you can blink when you need to. I am gonna be pretty close to you. Okay. And I'm gonna be just looking through the magnifying lens and trying to kind of see into the back of your eyeball. Yeah, it's pretty cool. Okay, you ready? You can look wherever you like. You can pick a sort of spot in the distance or wherever. Doesn't make a difference. Okay. Alright, I'm just coming in pretty close now. We're going to do the same thing on the other side, but I'm going to give you a minute to readjust. As I think you know, because I'm pretty sure when you had your accident, you did a cranial nerve exam here, right? Yeah, I remember. And I'm sure you remember from that test that when one eye is affected by light, the other is also affected. Right, so I just want to let everything kind of get back to its stasis. Okay. Yeah, I think the only thing here about rainy days is it makes everyone a little sluggish. I want to yawn right now. Yeah, but it doesn't really increase or decrease our patient count. Yeah, pretty consistent, which is good. I like having patients because it makes the day go by faster. Yeah. I know some people prefer to just do nothing and they can handle the time sort of going slow, so to speak. I'm not one of those people. Yeah. No, I totally agree. Yeah. Okay. Are you feeling okay now? Okay, good. So I'm going to do the same thing on your right eye. Okay. So just again, anywhere. Very good. Okay. The last thing I'm going to do is bring the light in close to you and far away. And I just want you to follow with your eyes again. Okay? I'll give you another minute. Have you had your lunch yet? Or dinner? I don't know when you eat usually. I think I eat kind of late compared to most people. Yeah, I'm looking forward to my meal. Yeah, I've been craving donuts a lot lately for some reason. I don't know. I would really kill for like a lemon filled or raspberry filled. Yeah, I like that sweet. Okay, so we are going to follow the light as it comes in. You don't have to go cross-eyed or anything. I'm gonna try to just bring it to one side or the other. Okay, so just look at the tip of my light. Actually, you know what'll make this easier? There we go. Better, right? Be easier for me to see too. Okay. But do let me know if the brighter light is hurting you at all. First, I'm just gonna come out to in. Okay. Good. Okay. And next, can you look up? Okay. Good. Okay. And last time we're going to go in and then out again this time. Okay. So look at the light this time again. In close and follow it back out. Good. I'll do the other side. Bring it in. Good. Keep following it. and follow it back out. Okay, great. Perfect. Make a note. While your eye tracking looked really good, I didn't see any issues. I'm just ruling out a couple things that it wasn't likely to be, but could be related. So, and you haven't been experiencing any sort of like visually triggered headaches or migraines. Okay. Alright, so let's move on to our hearing portion. I'm gonna take off these gloves. So once again, for this portion of the exam, there we go. I'm just going to be doing slow taps, okay? And there's nothing special about the sequence. There's nothing special about anything other than your ability to hear, okay? And like I said, I may have you compare some. Really just tell me anything that you notice. Let's just say it like that. Right, so if you think that the first sound and the sixth sound are very similar, tell me that. If one of them seems like really hard for you to hear comparatively, tell me that. Okay? Whatever feedback you feel like volunteering. Alright, so I'm going to get started. Like I said, I just have a number of objects here. They're just random objects, and I'm going to hold them near to your ear, okay, and then progressively move farther away. You ready? You can close your eyes, you can look around, whatever helps you concentrate. Alright, so this is sound number 1. Can you hear that? Good. Still. Okay. Okay. Kind of faint. Okay. I'm gonna do it one more time close up. Is there a drastic difference between when it's close up and far away? Okay. Alright, we're gonna do the same thing on the other side. You ready? Okay. Okay. Still hear it? Okay. Alright. Okay. And once more up close. Is there a drastic difference between the far away and the close up? Okay. Alright. Alright. I'm gonna move to a different sort of sound. Ready? Same thing. Okay. Okay. Once more close up. Okay. Okay, so you felt like that one was more consistent. Okay. Alright, let's see if that's the same on the other side. Okay, you ready? Okay. Next spot. Still? Okay. Okay, last one. Okay, and up close. Okay. So overall you felt like that one was, you could hear it more consistently, better. That's not really well phrased, but you know what I mean. Or hopefully I know what you mean. Okay, so the first one diminished more as it moved further away. There we go. Okay. Alright. Moving on. Okay. 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 Okay, and up close again. Okay. A little softer. Okay. That side. Okay. Good. Good. Okay. And up close. Okay. So overall that sound was the softest so far. Okay. Good to know. Gonna move on. You doing okay? Are you straining or struggling to hear the noises? Okay. Let me know. Okay. Ready? Okay. Okay. Does that sound different? Okay, good. And up close. Good. Okay. Other side. A little more muffled. Okay. Does that sound different? And clearer. Okay. Okay. I'm gonna make a few notes so I don't forget. So I'm just gonna put everything you've told me thus far about the sounds. Okay. If you think of anything else you want to add, just tell me. Okay. keep on moving. Trying to get organized so I don't duplicate. Okay, you ready? Do one more. Okay, and up close. Okay, we're gonna do the other side. Okay. All right. And one more then. Okay, up close. Okay, alright. Next one. Okay, that sounds kind of familiar. Okay. To one of the other ones, right? Okay. Almost like a mixture, okay. Last one. Up close. Okay, interesting. All right. Ready? Very different. Okay. All right. Good. Okay. One more up close. I almost forgot. Not a good proctor if I'm not doing the test right. Okay, other side. Okay. Good, one more. Okay, and up close. Okay. Ready? Okay, next. All right, last one. Up close. Okay, what do you mean by that? Difference between each tap? Okay, alright, let's try the other side and see if that's the same. Okay. Good. A little less pronounced on that side. Okay. Alright, we've got one more. You're doing great. Okay, here we go. 2 times ago. Okay. Good. Okay. Okay. Other side. Good. Okay, last one. And up close. Okay. Okay, so only 2 pairs sounded similar to you. And one was from the first group to the second group, and then the other one was 2 in the second group, right? Okay. Okay. Was it just the one that it sounded like each tap kind of had a different tone? Okay. Was anyone the most pleasant to you? Okay. And how about the harshest or least pleasant? Okay. Can you remember if any of them were the hardest to hear in general? Okay. All right. So that is the extent of the hearing portion that we're doing today. I think that this should be helpful, illuminating information. I'm going to pass on your chart to the doctor who is here today and have them take a look at the findings. I am not entirely sure what they're gonna say. Usually I try to give some sort of a probable thing, but the thing that's throwing me off is that plasma that I saw. I'm just not sure how that plays into the equation and whether or not it does. But it's great that you were able to hear all of the sounds and that they were different to you in different times. However, you did mention that a few of them sounded pretty muffled, and that aligns with what you were initially telling me about having some perceived hearing loss because the ranges at which those taps were played was the same throughout, and the force was pretty similar as well, so the tones shouldn't have ranged that much, and 1 or 2 of the ones that you said were muffled were actually some of the louder tones in terms of objects. Okay, typically speaking. Alright, so don't panic. There's a chance that you just have an infection. We'll prescribe an antibiotic and your hearing will be restored within a couple of days. Okay. If not, they'll probably have you come in for some more testing, and we'll actually get in there with some tools and look around in your ear canal. Yeah. It shouldn't hurt, but if your ear becomes more tender, we have the word is not coming to me. We can desensitize the area with a spray. Anesthetic, thank you. Yeah. It's just a topical short-term thing. Okay. And I would recommend that if they do have you come in for more testing, take some Tylenol or leave beforehand, like 30 minutes before you come. Okay, and that way, if you do get the anesthetic, or if you don't, you'll have some of that pain relief immediately. Okay. Alright, well, it was a pleasure seeing you today. I'm sorry that this is happening for you, but you did a great job, and as you know, you're welcome to stay here for as long as you'd like. You can sleep in the bed. There are snacks and drinks behind you in the refrigerator, and whenever you're ready to rejoin the world, you can exit. And they should be back to you with these results by the end of the day. Okay? You don't have to check out with reception. Yeah, so if you don't want to talk to anyone on the way out, you don't have to. Okay. Alright, well, hopefully it's just a quick cure infection. But if not, I'm sure I'll see you again